All right. Good morning, everyone. Welcome to the Age of Central Texas seminar for the fall, Medicare 101. We're so excited to present this information to you. My name is Bonnie, and I am the Information and Resource Center Program Director. I field calls from the general public, from older adults and caregivers who are looking for resources. And right now, as we're approached an open enrollment season, I've been getting so many calls about Medicare and what to think about, and I don't know the answers, and I tend to refer people to Yvette and the Area Agency on Aging and her team of folks over there to give some great information. So I'm thrilled that she's joining us today. I just wanted to take a few seconds to thank you all for participating in this and to let you know that at the bottom of your screen is a Q&A box. And so you can put your questions in there for Yvette. And then if you will be patient, because we're going to answer the questions at the end, that would be great. I wanted to also take a moment to let you know about Age of Central Texas. I'm sure that many of you are familiar with Age of Central Texas, but I wanted to just give you a quick, brief overview of some of the programs that we offer. We've been around for almost 40 years, serving Austin and Central Texas. We serve 4 counties: Hayes County, Bastrop County, Williamson County, and Travis County. We take calls and inquiries from all over the place as well. We have programs. Our first point of connection typically is through our health and equipment lending program, or our HELP program. We provide durable medical equipment to anybody who needs it. So wheelchairs, walkers, scooters, knee scooters if you're having foot surgery, that sort of thing. We also have bedside commodes and elevated toilet seats, all of those things that people need to make their lives a little bit easier and that they can thrive while they're navigating the challenges of aging. I have my dog with me, and now he likes to be my lap buddy, everyone. So I'm going to put him down because he's heard something out in the other room. I also wanted to tell you about our Thrive Social and Wellness program, which is our adult day center. It's our licensed adult day center. We have 2 of them, and we will be opening our South location soon, I hope. Our Thrive program is really a great resource for folks who are not able to stay at home on their own during the day and their caregiver needs to do some stuff, or if they're feeling a little bit isolated and they just want to have a sense of community, a place to go to a couple times a week, 5 days a week, where they have friends and activities. It's a really great resource for folks. We also have our Memory Connections program, which is our brain health program. It's for folks who have been recently diagnosed or in early stage mild cognitive impairment or dementia causing diseases. It's really building a community while helping folks to keep their brain as healthy as possible. A lot of great activities, evidence-based activities like a cognitive stimulation therapy, the Trailhead Brain Health Series. We do a lot of fun things as well. We have a members support group, which it's quite fun. I facilitate that, and we end up talking about all kinds of things. It's one of my favorite things to do during the week. And then we do some outings as well. We have Caregiver U, which is our education arm at Age of Central Texas. We provide free education classes to folks out in the community for caregivers and for older adults. And we have a lot of courses happening right now throughout the 4 counties that we serve. And then my program, which is Information and Resource, like I said, I help get people connected to fantastic resources like those resources at the Area Agency on Aging and people like Yvette. So without further ado, I would love to introduce you to Yvette. I see there's somebody asked, I'm going to get this question a lot, and I'm going to answer it right now because I know it's on everybody's mind. Is this being recorded and will it be available? It is being recorded, everyone. It is being recorded, and it will be available on the Age of Central Texas YouTube channel, probably by the middle of next week. So you will be able to find it and see it and watch it again and get some of those great tips from Yvette. So let me introduce you to Yvette. Yvette is the lead benefits counselor with the Area Agency on Aging. She's been involved in this space for a long time. She worked with Texas Health and Human Services for over 15 years, assisting people with disabilities to qualify for community programs that were offered by the state, like Medicaid, before coming to AAA. That's our short-term way of saying Area Agency on Aging, AAA. She's been doing this work for over 29 years. I'm just so impressed by that, Yvette. That's so great.
And I'm only 30.
I'm nearly 30. She and her team assist individuals who are 65 years or older or 65 years and under with some kind of qualifying disability to access Medicare benefits. And AAA, y'all, serves 10 counties. They have such a huge area. It's amazing to me. Yvette says that her primary role as the Leads Benefit Counselor is to support agency initiatives focused on providing information, education, and care support for other family caregivers. And she's a caregiver herself, so I hope she'll speak just a little bit about that. But we know how overwhelming caregiving can be, so I'm glad that you're able to join us this morning, Yvette. She also is a volunteer, and she also is a dog lover, has a puppy. So I know that if you see either of us kind of shifting a little bit, it's probably dogs at our feet asking to be picked up. So Yvette, thank you for joining us. We're looking forward to hearing what you have to tell us.
Thank you for having me. Well, good morning, everyone. My name is Yvette McVey. As Miss Bunny stated, I do work for the Area Agency on Aging. I am a benefits counselor. And of course, every year, October the 15th through December the 7th, Medicare has an open enrollment, which allows its consumers or beneficiaries to look at your plans to decide if you need to make any changes to your current plan, or you can remain where you at. If you're good with your current plan and you don't have any problems with it, you do not have to renew it. You don't have to do anything. It'll just roll over, okay? October the 15th through December the 7th is an opportunity to give current Medicare recipients, like I stated, time to review or compare their plans to current plans. Now, we haven't got the official report on what the changes are going to be. The state is always behind, even though open enrollment starts next Monday. We have heard that the drug plans may increase 10 to 15%. The Part B premium, which is $164, will increase $10, taking it to $174.80 or $174.90. So those things that we are aware of. And of course, last year, the insulin was capped at $35. There will be no changes with that. So let's get into it. So Medicare is a federally funded health program that is available to people that are 65 and older or 65 and under with a qualifying disability. If you are 65 and older, you have to be done worked 10 years or put in 40 quarters. Once you have done that, once you turn 65, you are Medicare eligible and you can apply for Medicare. Medicare has three parts. Parts A, which is hospitalization and your inpatient. Part B, which is your doctor's appointments and your outpatients. And Part D is your drug coverage or prescription coverage. During your initial enrollment period, when you turn 65, that's called your initial enrollment period, you have 7 months to decide how you plan to cover your health. 3 months prior to your birthday month, your actual birthday month, and then 3 months afterwards. So this is September. If you were born in September, June, July, August. So you can start looking at your Medicare coverage in June. Then September is your birthday month. And then you have until October, December to complete your Medicare coverage, okay? So 7 months to decide how you're gonna do your coverage. It's 3 ways that you can cover your health care. So you can remain on traditional Medicare, which covers parts A and B. Medicare will cover 80%, and you will be responsible for 20%. Part D is separate, so you would have to purchase a standalone drug plan. If you would like to remain on traditional Medicare and pick up a supplement, which is called Medigap, the Medigap will cover that 20%. Okay. Then you have the Advantage plan, which is called Part C. Part C, the Advantage plan, bundles parts A, B, and D together. So if you go to the doctor, you would give them your Advantage plan. Now, the Advantage plan is a private sector of insurance companies: Aetna, Blue Cross Blue Shield, Baylor Scott and White, Ascension, WellCare, Humana, United, etc. That contracts with Medicare to cover your A, B, and D. The Advantage plans, like I said, it usually covers Parts A, Part B, and Part D together. So you don't have to purchase a separate drug plan unless it's not included in that plan. Advantage plan usually starts at $0. How they make their money is when you go see specialists or go to the hospital or get your labs or your MRIs, or you need durable medical equipment, okay? The supplement, where you will have Part A and Part B, and Medicare pays 80%, and then you're responsible for the 20%. If you go to the doctor, you will show them your Medicare card and then your supplement card. The supplement will cover the 20% of all any procedures you have done. Part B in the supplement plan, the Medigap plan, does have a deductible of $233 right now, which is your doctor's appointments. And once you meet that $233 deductible, then it will cover all the out-of-pocket costs. Okay. So during your initial enrollment period, like I say, you have 7 months to make a decision, although the Medicare will not be effective until your birthday month. So even though you could start in June, it still won't be effective till September 1st. You can go to ssa.gov and apply for Medicare online, or call your local Social Security office and set up an appointment, and you can apply for Medicare there. Now, I know some people, once they turn 65, they do not draw their Social Security check. If you do not draw your Social Security check but decide to get on Medicare, then you will have to pay the $164 out of pocket. They will send you like a coupon book or a bill in the mail, and they take that out quarterly. So it'll be $164 times 3, and you will pay that each quarter if you do not draw your Social Security check. Now, if you call and say, I'm drawing my Social Security check, they automatically enroll you in Medicare, Parts A and B, and then they will take out the $164.90 out of your check before you even receive it. Okay? If you decide to work past 65 and you have a creditable insurance through your employer, and that's insurance that's accepted or approved by Medicare, then you do not have to sign up for Part B. We do recommend you sign up for Part A because it's free if you have worked and put in your 10 years or 40 quarters. So if you are working past 65 and you decide I'm going to continue to work, and your employer has coverage like through Blue Cross Blue Shield or United or Aetna, you do not have to sign up for Part B. You can sign up for Part A because you've already worked and paid into it. It'll just be additional coverage if you go into the hospital. The Part B will be covered through your employer's insurance, and your Part D will be covered through your employer's insurance until you decide to retire or quit your job. Once you decide to retire and you say, okay, I'm gonna retire at 67 or 68, you need to get a form completed by Social Security, and you take it to your HR to show that you had coverage during that time from 65 to 68. The HR will complete the form. I think it's Form 44 on the ssa.gov website, and they'll complete it and just let Social Security know that you had medical coverage during the time you turned 65 to avoid penalties. If you turn 65 and you're not working and you do not have medical insurance and you do not sign up for Part B, you will face a penalty. It's 10% for every 12 months you do not have Part B. Okay? So be careful when you say, well, I can't afford it or I'll get it later, because you will have a penalty that does not go away. We do have programs that can help you with the Part B premium called the Medicare Savings Program. It is state funded through Medicaid. It does have it is income and resource based. And if you fall within that income or resource, you can apply for the program and they will pay for the Part B premium. Also, we have another program that's federally funded called Low Income Subsidy or Extra Help, that's through the Social Security Administration, that helps with your Part D, your drug plans, and your prescriptions. It is also income and resource based. And if you fall within those guidelines, me or it's 3BCs, we can help you complete that application and submit it to Social Security. We also help complete the Medicare Savings Program. Like I said, it is state funded through Medicaid. We help complete that application, and then we send it back to you for you to sign, to review and sign. And then, of course, with a self-paid envelope, stamped envelope, for you to submit to Texas Medicaid. And it takes them 45 to 90 days to process that application. Once they process it, they'll notify you by mail if you have if you can receive that program. They have 3 different programs that you can apply for. One is called QMB. It pays for the Part B premium and your copays and deductibles. Then they have a SLMB and a QI. Those 2 programs only pay for the Part B premiums and not the copays or deductibles. I know I'm going a little fast. Just please remember to put your questions in the chat box and we will answer them at the end of this presentation. So those 2 programs, like I said, can help you with the cost of the Part B premium and your drug costs. But of course, they are income and resource based. Okay. So back to working past 65, if you decide to work and your company has insurance that's approved by Medicare as creditable, you do not have to sign up for Part B. But once you decide to retire or you quit or you lose your job, you have 8 months to sign up for Medicare without facing a penalty. Okay, but if you know you're going to retire, you put your retire date that I'm going to retire in December, go ahead and sign up for your Medicare so you will not have any break in services. Coordinate that with HR and Social Security so your Social Security will be effective January 1. Okay, so you can coordinate with your HR person and Social Security so you won't have a break in your insurance coverage. Also, if you pay into a HSA, health saver program or plan, you have to stop paying into that 6 months before you sign up for Social Security. If not, it will be considered as income. Okay, so you want to make sure you stop paying into that, the HSA, 6 months before you draw your Social Security. If you continue to work after 65 and you want to continue to pay into your HSA account, you cannot sign up for Part A. Once you sign up for Part A, you can no longer participate in the HSA account. Okay, so be mindful of that. They don't allow you to do that. Again, it will be counted towards your income, which may increase your Part B premium payment. So another thing too, I know a lot of people, some people don't take prescriptions or they take vitamins or they take holistic medications. And sometimes when they'll turn 65 and they say, well, I don't take prescriptions. I don't do that. And then you don't pick up the Part D premium, you also face a penalty down the road if you decide to pick it up, or if you have a heart attack or a stroke or get cancer and need treatment. 5 years down the road, and then you come back and say, oh, I didn't get Part D because at the time I didn't take drugs or prescriptions. I was taking vitamins. So 3 years have passed by. You need the Part D now because of your cancer treatments. You will face a penalty of 1% of each month that you did not have Part D. And right now, that's based off of $33 and some change. And those penalties do not go away unless you qualify for the Medicare Savings Program or extra help. So be careful and be mindful of what you don't accept or what you think you don't need. Because at the end of the day or the year, it could hurt you in the long run. A lot of people will ask, like, okay, that what plan or how should I choose to get my Medicare coverage? And that's a good question. The answer is, how healthy are you? What doctors do you use? What hospitals would you like to go to? What pharmacies do you use? You want to put all that in consideration when choosing your coverage, right? I always compare it to like automobile insurance. Either you're going to have liability or you're going to have full coverage. A full coverage would be considered the Medigap because Medigap, like I said, it covers the 20%. So you don't have no out-of-pocket costs because it covers that. And you don't have to worry about all those excess bills coming in. But if you can't afford a supplement, then you have the Advantage plan, which will give you the coverage you need, and you don't have to worry about having those penalties. Another thing is if you are sick or sickly already and have a lot of health issues during your initial enrollment period when you turn 65, we recommend, if you're leaning towards a supplement or the Medigap plan, to go ahead and sign up during your initial enrollment period because they do not have the medical underwriting. Once you turn 65 and you say, oh, I'm healthy, I'm gonna get the Advantage plan because I don't go to the doctor that much. And then again, something happened 5 years down the road, you have cancer or you have a stroke or heart attack, and the bills start rolling in and you want to get the supplemental plan, aka Medigap. They're gonna look at your previous medical conditions. And then once they look at, oh, she had a stroke or she has cancer or she has experienced a heart attack, they will not cover you because you're a liability now, right? But once you turn 65, and even if you had previous conditions, a stroke, cancer, a heart attack, or anything like that, they won't look at it during that period, the initial enrollment period. So when you turn 65, if you're leaning towards the supplement, aka Medigap, go ahead and sign up for it during your initial enrollment period, so you will not face or will not have to undergo the medical underwriting. And I always share this information. I did work for Medicaid for 15 years. I've been doing this for 4 years. And so my mom, I always use her as an example. She has a kidney transplant. She has heart problems, she's diabetic. She has GERD. She has diverticulitis. She has had a bowel obstruction. You name it, she's had it. Had I known then what I know now, I would have recommended that she get on a supplement. She also sees 7 specialists. She's on an Advantage plan and she loves her Advantage plan, but she pays $35 each time she goes to see a specialist. And then, of course, they may order labs or x-rays or CAT scans or MRIs, depending on what's going on, to make sure she's healthy, or check on the kidney, what have you. And then, of course, that's additional out-of-pocket costs. So had I known what I know now, I would have recommended she get a supplement. Now, like I stated before, she loves her Advantage plan. That works for her. That is an option that she has, and she likes it. That would drive me crazy. You know what I'm saying? Just the bills coming in when you go to the emergency room or when you have a hospital stay, then you got to worry about the bills coming in from the hospital. With the supplement or the Medigap, you don't have that because it covers that excess cost. So that's an example on the Advantage plan versus the Medigap. Another thing is the Advantage plan, they do offer vision and dental. They also have some incentives. They have a flex card where they'll give you a certain amount of money where you can buy groceries or pay your internet bill or cell phone bill. Some even allow you to buy dog food or cat food for your pets, food for your pets. They sometimes offer you a high amount for dental, which is very important. But when making those decisions, make sure that you have that the plan that you take or receive, that your doctor takes that plan, right? Because you don't want to get $3,000 worth of dental work and then your doctor is in Houston. The vision is it covers your lenses and your frames, and of course your doctor visit. The dental is only preventive, which means you'll get 2 cleanings a year and then your x-rays. If you're needing something more detailed, root canal, dentures, fillings, teeth pull, a bridge, anything like that, it does not cover that. It's very limited to that coverage. It's only preventive, which, like I stated before, is like your x-rays and your cleanings. Okay. But you do have an option. I always tell people, look at your options, look at your money, look at your health, look at your doctors, look at the hospitals you want to use, and the pharmacies. Another thing when choosing an Advantage plan, if you choose to go that route, you want to make sure your prescriptions are covered, right? So if you have a lot of prescriptions, if you have 10 prescriptions, you want to make sure all 10 are covered, or at least the most expensive ones are covered, right? So that's another factor that you look into when choosing your Advantage plan. You want to make sure, your health is covered as far as your primary doctors, your specialists. You want to make sure your medication is covered. You want to make sure the hospital takes it. If you like Baylor Scott and White, you want to make sure the plan you receive takes Baylor Scott and White, because you don't want to be out of network. Because Advantage plans do work off of a network. You have an HMO plan and you have a PPO plan. So your HMO plan, you usually have to go in and get a referral from your primary doctor to go see a specialist or get physical therapy or anything of that nature. If you get a PPO plan, you don't have to get a referral. You can just go to the doctor or the specialist that takes that plan. So if you got an Advantage plan and it's Humana and it's a PPO plan, and if I want to go get, say I'm having a hard time walking or my gait is unsteady and I think I could benefit from physical therapy, if I have Humana, a PPO plan, I can look up a doctor, or I could call Humana and say, hey, I need a physical therapist that takes Humana. Then they will send you a list of physical therapists in your area that take it, and you can go to that physician, to that doctor. If you have an HMO plan through Humana, and I'm not wavering one way or the other, my mom has Humana, so that's why I'm saying it. And you have an HMO plan, then you have to go see your PCP and say, hey, I think I would benefit from some physical therapy. And then they refer you to a physical therapist. So that's the difference between HMO and PPO. Okay. Both plans, you have to stay within network. Both plans, the doctor or the specialist need to take that particular plan, Humana, Blue Cross Blue Shield, Aetna. But HMO, you need a referral. PPO, you can go where they accept the plan. Okay. Any questions? I'll take a break and answer some questions.
I have questions in the chat or in the Q&A. So Jamie asks about the birthday. If you don't enroll until the 2nd or 3rd month after your birthday, is coverage backdated to your birthday?
That's a good question. If you sign up for your Social Security, it will go ahead and do it for that day. If you wait 2 months, it's gonna go. You know what? I don't know. I don't think so, because that means they would have to backdate the coverage and they're not going to cover it. Like if you have a previous, like if you say I'm born in December, then I don't sign up to February. If I went to the doctor back in December, they're not going to cover my December doctor's appointment.
Okay, so they will not. Do
No.
you need to enroll? Jamie also asked, do you need to enroll if you have coverage through your spouse?
So if you have coverage through your spouse, as long as it's not a retirement insurance, because that's his retirement insurance, but as soon as he quit working and or he goes onto his retiree insurance and you're Medicare eligible, then you have to sign up for Medicare. But when you sign up, you still have to turn in that form 44 stating you had that coverage through your husband's employer or spouse's employer.
Okay. A spouse having Medicare does not transfer to you. You both would need to apply for your Medicare if you're of age.
Right. Unless the spouse, the wife didn't work or put into it, or the spouse didn't work and put into it, and she goes or he goes up under the spouse's Medicare, you can do that. But you have to be married 10 plus years.
Okay, perfect. Nancy Cato wanted to ask about Advantage plans. And so Nancy, I'm just going to ask you if you have a more specific question about Advantage plans to go ahead and put that back into the Q&A, because I know that Yvette did speak a lot just now about the Advantage plan. So if you have another specific question, go ahead and add that. An anonymous attendee said, I am still on my employer's insurance till the end of the month. I signed up for Part B, but I never used it because of the employer's insurance. So will I still have to pay the Part B premium?
Yes. If you've already, when did you sign up for it? Oh, they're anonymous. So if you signed up for the Part B while you were still on your employer's insurance, you should have received a bill to pay it. If you've signed up for Part B and have not paid Part B, you're going to have a bill. And you're going to have to pay that bill before you can get Part B once you officially retire, quit your job, or what have you. So I will call Social Security and see, because what happens if you signed up for Part B and you're not drawing your Social Security, they didn't get a payment. They sent you a payment booklet. And if you didn't pay that 3 months, that 164 3 times, then you have a bill out there lingering for maybe, depending on how long, it could be $800.
Yikes. Okay. I'm going to probably say this person's name wrong, but it's Shmuel, Shmuel. They asked, how does the Medicare program from your presentation support improvement to medical care services for older adults from poor and low socioeconomic groups of the population? So, did that question make sense to you? Do they track data of who's using Medicare or Medicaid to make improvements to the care that's offered?
I'm gonna say no, because Medicare, that's another thing. Medicare does not cover long-term care. So if you need personal care to come into your home to help cook, clean, give you a bath, do laundry, Medicare does not do that. And you would think, after tracking that, because we get so many calls about, parents, adult children taking care of parents, needing services for someone to come in to provide for the parent while they go, to work or want to run errands, or they're not able to care for the parents themselves due to their own disabilities. So no, they don't. You would think they would, because I feel like if they did, they would make those improvements to add caregiver support, which they do not.
They do not.
So I'm gonna say no.
No.
And if they do track it, they have not made any improvements to do so.
Okay. Nancy Cato asked, are the plans consistent within each provider? For example, are all United Healthcare Advantage plans the same? Are the Advantage plans all kind of consistent?
They are the same. The only thing, they cover the same things, right? What makes them different is the area you are in and the medications that you take. That's what's going to make it different. Because when you pull up, you can go to the Medicare.gov website and compare the plans, do a plan comparison. It goes by your zip code. Once you put your zip code in, it'll ask you questions like, do you receive help from the state or the federal support? And then you have to add in your prescriptions. So once you put in your prescriptions, that's what's going to determine the plans. They're all going to cover Part A. They're going to cover Part B. They're going to cover your drugs. It's just the drugs is going to determine what plan is going to benefit you. Because when you look at the drugs, it may say one plan may have a higher out-of-pocket cost for the drugs, where the other plan does not. Or one plan may cover all 8 drugs and one plan may cover 5. One plan may have preferred pharmacy HEB, the other plan may have a preferred pharmacy Walgreens, but they all cover the same things.
Okay, that makes sense. Selena asks, do you know if the state of Texas Health Select secondary coverage is a Medigap coverage?
You talking about the state of Texas insurance, like y'all private insurance?
She said the state of Texas Health Select secondary coverage. That's a private insurance, I'm thinking.
So if that's through the employer through the state of Texas, it's not a Medigap. If you have that, so it can work as a what we call, it works like a supplement. So if you have state insurance and you've been grandfathered in, so you once you retire, you have coverage through Blue Cross Blue Shield. We recommend you just pick up Medicare, right? Parts A and B, because the Health Select is going to work as the supplement. So if Medicare is primary, what Medicare doesn't pay for, that 20%, Blue Cross Blue Shield, Health Select will, Health Select will cover that. If Health Select is the primary insurance, what they don't cover, Medicare will. So it works like a supplement, but it is not. It's private.
Okay. Laura asked, my husband is 58 and qualified for Medicare this year due to ESRD. Does he need to enroll again this year?
No, he doesn't. But the thing about him, though, because he's 58, once he turns 65, this is a good example. Once he turns 65, because of his disability, if he chooses to get a supplement through Medigap, he can, and they will not look at his previous medical conditions.
Oh, that's good to know.
Yes, that's the good example.
Thank
So
you.
if you're looking at that and you already kind of can gauge how the bills are coming in with the Advantage plan or whatever plan he has, then once he turns 65, if you want to, say, well, we're going to get a supplement because we don't want all this out-of-pocket costs. The supplement does cost money. They usually start at $85 and they can go anywhere up to $1,000, but they usually start at a low cost of $85 to $100. Once he turns 65, if he decides I want to get Medigap, he can, and they will not look at his previous medical conditions. Now, if he turns 65 and he wait 3 years or 5 years and then want to go to Medigap, they're going to look at that previous condition.
Oh, great. That's good to know. Okay. Jamie asks, my husband has insurance through my coverage with my employer. He should still enroll in Part B, correct?
So if he's turning 65 and he has coverage through your employer, as long as this is not a retiree insurance, he can remain on your insurance and sign up for Part A.
But not Part B?
No, he don't have to sign up for Part B because her insurance is covering it.
Okay.
But once she retires or loses her job, or he doesn't have coverage for some strange reason, if they decide we're not covering spouses, then he needs to sign up for his Part B, have HR fill out the Form 44 stating he was covered by her insurance for that amount of time, so he will not face that penalty.
Oh, good. Okay. Hilda asks, does Medicare for those people who are less than 65 with special conditions work in the same way that regular Medicare does for people who are 65 and older?
It does. The only thing is, if you're 65 and under, if you get a supplemental plan, the Medigap, it only offers 2 plans, 2 Medigaps, and they are very pricey. They're like $485, and then one of them is like $3 something to $1,000. But it works the same. It works the same. If you have a qualifying disability, unless it's unless you're in kidney, end-stage renal failure, or you have Lou Gehrig's disease, you have to wait 25 months before you can qualify for Medicare. If you have Lou Gehrig's disease or end-stage renal, or you are in end-stage renal failure, then you immediately qualify for your Social Security and you receive Medicare. You don't have to wait the 25 months.
Wow. Okay. So 25 months after you have some kind of a disability is
Once
when-
Social Security deems you disabled. So a lot of people say, oh, I'm disabled, I need Medicare. You have to go through the process of filing for your SSDI, Social Security Disability Insurance or income. And then once they deem you disabled, you have to wait 25 months to get on Medicare. Unless you have end-stage renal disease or Lou Gehrig's, then you don't have to wait the 25 months.
what do people do who have some kind of like, somebody's had a stroke and now they're quadriplegic, and from the time that happens to the time that 25 months goes around, what do people do?
So sometimes they may qualify for Medicaid, or they may can get the marketplace insurance, the Obamacare.
Mhm.
Travis County has MAPS and other, entities. You just have to look for the resource.
Wow.
Yeah.
That goes back to that conversation that Shmuel was asking about, like, how do we make improvements to this
Right.
system? Yeah.
And this is something that's been going on for at least 4 years since I've been on this side. So yes, that's why I say if they are doing it, they haven't made any improvements as of yet.
Yeah. So everybody needs to make sure that they're engaged, you're doing civic engagement and voting and talking to their representatives. All right. Julie says, my mom has spent decades as an unpaid caregiver, so she doesn't have 10 years of work history. How does that impact her Medicare eligibility?
She won't receive it unless her husband, if she was married for 10 plus years, she can try to file up under his Social Security and the Medicare.
Okay. Does it work the same way with Social Security benefits? I attended a webinar like this recently, and they were saying that if you were married to somebody for over 10 years and then you got divorced, you could qualify still for Social Security under that person's.
That is correct. As long
record.
as you don't get remarried. If you remarried, you can't do it.
Okay.
And usually, even if you say you got divorced, but you still have that 10, 20, 30 years in, you could still file up under his Social Security, and whoever receives the most money, that's the check you get. So if your husband worked and put in, and maybe you didn't because you were a housewife, and then you got out and worked later on in life, and his Social Security may be 1,700 and yours may be 500, and y'all are divorced, but you were married 20 years. If you did not get remarried, you can file his Social Security. Even if he got remarried, the wife that has put in the longest, because this happened with my mom, you can still file because you got the 20, 30 years in versus that 5-year, 2-year, 3-year wife.
Okay.
So file. Y'all fight over it. You have every right to it.
So does that also entitle you to the Medicare coverage from that spouse or that ex-spouse? Oh, cool.
Yes.
That's a great thing to know.
Yeah, so getting married does help. It does have benefits. Don't let them tell you nothing different.
Okay. And one person wrote, I'm paying Cigna health insurance $186.55 per month and haven't had an optical person indicated that I didn't need this. Can you comment to that? So some person at the optician said that they didn't need the Cigna health insurance.
What other insurance do you have?
So we'll wait and see what that other person, the anonymous attendee who asked that question. Let's see. I'm not sure if I can. No. Whoever asked that question.
I can't say you don't need it, because if you have Medicare, you have to, if you are Medicare eligible, you need Medicare. If you have even if you have a retiree insurance through the retiree insurance, like through the state or feds, we still recommend, even veterans, we recommend that you sign up for Part A and B. Because if something happens, and this is example, the post office, this lady worked for the post office has now decided that they are no longer paying for their retiree insurances. So she has to sign up for Medicare. It's a possibility that she may face a penalty because she didn't sign up, and she in her 70s.
Oh, no.
I want to say 15 years, maybe 8. No, she's 70. So 78, she's up in her 70s. So she's concerned that she has this penalty. I think she's 12 years we talked about. So she's 77. 12 years she's been up under her retiree insurance through the post office, and now they decided they're no longer going to offer this coverage, and she has to sign up for Medicare. So she may have 12 years worth of penalties because she didn't initially sign up because she had coverage through her retiree insurance. So we always make this joke. I always tell them, people say, oh, I got the VA, I got the state. Oh, that's not guaranteed. I will say if one crumble, we all gonna crumble. So if the state or the feds crumble, Medicare probably gonna crumble with it. But when you look at the post office has decided we're not doing this, and she's 12 years out, that's 12 years, 10% times 12.
Wow.
No, it's 10% times 12 months you didn't have it. So that's a lot.
It's going to be a lot.
It's going to be a lot. And I'm sure she's over the income resource, because if she draws her Social Security and she get her retirement check from the post office, she's not going to qualify for any services or any program to help her pay for that.
Oh my goodness. Oh, thank you for sharing that. Deanna asks, would you sign up for Medicare and the supplement or Medigap on the same website, or do you need to go to different sites for each one? If I go to Humana to purchase Medigap, will they automatically register me for Medicare?
No, you have to register yourself. When you turn 65, unless you draw your Social Security at 65, nobody's going to automatically enroll you in anything. Now, if you go to SSA.gov, you sign up for Medicare and you sign up for Social Security money, they're going to automatically sign you up. Well, if you sign up for your Social Security, they're going to automatically sign you up for parts A and B. You still have to decide if I'm going to stay on traditional Medicare, get a supplement, or get an Advantage plan, because it's only A and B. It's not D. So you have A and B, but you don't have drug coverage. So if you decide to work and not sign up for your monies because you want to wait till 66 and a half or 67, then you will have to let Social Security know I'm signing up for parts A and B. They will not do it for you.
The basic rule of thumb, I think, Yvette, is when it's time to sign up, and you got to do it yourself. Nobody's going to be checking. Nobody's checking on you.
Yes, unless you draw your Social Security, then they would do it. So when you look at a Medigap, we partner with certain insurance brokers. You have to go through an insurance broker. If you don't want to call us, please use someone locally. Do not go to Walmart. Do not, because they are not local people. You want to get in contact with somebody that's locally, that knows your area, that knows the plans, that can tell you the backside, because they have, different plans to do different things that we cannot see. So as a benefits counselor, but they can give you the ins and outs locally. Don't answer the phone and talk to nobody. Don't listen to Mr. Joe Namath. You need a local representative. And that's what the BCs are here for. We're also known as your SHIP counselors. So if you call Medicare and they say, call your SHIP counselors, that's us. Call your local person. Okay. That's how, because then something's going to happen. Like I said, they don't know nothing about Texas. They may be licensed. They may have a Texas license, but they're out of California. They can't give you all the information you're going to need for your services.
Thank you for touching on that. I had actually written a question because I hear this a lot in my role at Age. The question I wrote for myself to ask you was, would you recommend folks connect to a benefits counselor like yourself? Or I know there's really great benefits counselors too through foundation communities and the Prosper Centers. I think they got a big grant from AAA actually. So
yeah, but the thing is with them, I didn't mean to cut you off. They do marketplace and things of that nature. They don't do.
They do Medicare now too. They did get trained for Medicare, so I know that they're doing that.
I know some of the Medicare that they got trained for was like the MSP, because we kind of coordinated, right?
Mhm.
So we do partner with them, but when it comes to certain entities, only we're doing it at the time. I heard y'all
Okay.
may be coming aboard, but they can only go so far. So
Okay.
even if you do reach out to those, they're still local. And
Mhm.
if it's something that they cannot handle, they will refer y'all back to us. Because
And
we refer marketplace and everything goes to them because we don't do marketplace. So we work together. So
okay.
long as it's a local, if it's foundations, communities, family elder care, because I know they have benefits, people that help with benefits, but they can only go so far when it comes to Medicare. So
Okay.
usually they'll take you as far as they can go, and then they'll say, call us.
Okay. So how do they contact benefits counselor through AAA?
So we have a telephone number, which is 512-916-6178. And we have an email, which is bcinfo@capcog.org.
So bcinfo@capcog.org. I put
Mhm.
that into the chat, and the phone number 512-916-6178.
Correct.
Okay, so
Yeah, so we
everybody,
do work together. As long as you use somebody locally, they're gonna get you to where you need to be. If you call us and you're not Medicare eligible, we're gonna refer you to Foundations Community. If you call us and you need something that we don't do, we'll refer you to Age. We all work together, one voice, one sound.
we're all trying to do it. No
Yes,
wrong door, I think this is
no.
it. And there are some good private benefit Medicare people out there as well. But I think you're always the best first bet because you're all
So the
pros.
thing with us is we're nonprofit. We didn't kind of go into that. We're a nonprofit organization. We don't get any kickbacks. We are only here to educate and inform you. What you choose to do with that information is up to you. We do not want y'all going into the wilderness dark because it is open enrollment. Y'all are already getting a lot of calls, a lot of literature, a lot of magazines. I got mail here. I just threw away for my mom. I am a caregiver for my mother. And so I get calls like, hey, Medicare, da, 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 da. No, because my number is connected to her. So I just want everybody to be mindful that everything that looks good is not good. And the only thing is free is your mama's loving. Okay. So if it sounds too good to be true, generally it is too good to be true. And just if you feel like it's something, because they, like I say, they do have incentives. They do have these flex cards. They do offer over the counter prescriptions that you can purchase through a book or even over the counter. They do have these incentives, but be really careful when making those choices to change that you're not messing up your health care. Reach out to Miss Bunny, reach out to myself, reach out to Foundations Community. If you have a counselor or benefits or a caseworker, reach out to them so they can give you the resource to talk to someone locally that can guide you to make the right decision.
Thank you. You know, I was recently talking to a Medicaid person who said one of the most important things she wanted people to know is for people to say, please take me off your list. Because right now people are getting inundated with calls from different people trying to sell different supplements and that sort of thing. And the only way they'll stop calling you is if you go on the do not call registry. And if when you're talking to them, when you say, no, I'm not interested, don't just hang up. You need to say the words, take me off your list, because those companies are obligated to remove you from their call list if you say, take me off your list. So,
and another thing too, what we have found out recently, they will call and say, so my last name is McVey. They'll call and say, McVey, if you say yes, all they need is a yes. They may sign you up for something that you didn't even ask for. Be careful when confirming your identity. Do not give out social security numbers. Do not give out your Medicare number. Just do not do it unless you have called someone or you've had your caseworker to call someone for you. Don't do it. Know who you're talking to. Be careful. And I know sometimes you'd be like, oh yeah, I want to hear, or they'll say, oh, can we tell you about this plan we have that's new to your area? We're offering $3,000 in dental. And you say, yes. Next thing you know, you got that plan. So
oh,
be very careful in saying yes to certain things.
Thank
You
you.
can say, I would like to hear that, or you can explain it more. Just choose your words wisely. Don't yes, no, 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 no. Because once they get that yes, that's all they need. And they'll run with it. Because it's on a recorded line and they'll say, she said yes.
Oh
My
my
mom, I'm a caregiver and a BC, okay? I'm the ship counselor, the lead BC, and they changed my mama twice on Medicare. So they don't care.
oh my goodness.
Because she agreed to do it. She
Okay.
has a little dementia. She doesn't remember doing it, but just be careful.
Thank
And
you.
if it's something you feel like a scam or that it's a scam, you can call and report it to Medicare. You can call us. You can call Miss Bunny. She can call us, and we'll report it for you.
Yeah, absolutely. Going back to that anonymous attendee question. So they are paying, they have Medicare Part A and B from Cigna Insurance. They pay $186.55 a month. And an optical staff person said, you don't need that.
So is it a supplement? Can you say, is it a plan G, a plan F, a plan N, or is it an advantage plan?
You know
Can
what?
they put that in the chat?
Okay, we'll look for that in the chat.
Okay.
Laura is asking to talk a little bit more about advantage plans. How do they bundle the costs and what are the typical premiums?
There's no premiums. So like I stated earlier, how they make their money is when you go to the doctor, when you see a specialist, when you get x-rays, when you get MRIs, when you go into the hospital, when you go into a skilled nursing facility. That's how they make their money, because you have a copay, you have deductibles, and you have out-of-pocket costs that you have to meet. So they make their money through your copays, your deductibles, and your co-insurances.
Okay. Julie said, it seems like it's likely that a lot of people will need long-term care. So people will need Medicaid and Medicare. Is there a way to prepare for that? Or can you only apply for Medicaid if you need long-term care? I know Medicaid has a look-back period. Is there a way to get ahead of that?
So Medicaid, like I said, you have to be income and resource eligible, right? Everybody not going to be income and resource eligible. A lot of us have worked good jobs and paid into Social Security, and with Medicaid, certain programs have certain income ratios. So in order to qualify, like for the Medicare Savings Program that helps pay for your Part B premium, you can make as low as $1,296, but you can't make no more than $1,669. The resources is $9,000, right? That's stocks, bonds, annuities, IRAs, your savings account, CDs, what have you, right? When you get into Medicaid for the long-term care, right now you can't make over $2,500 and you can't have over $2,000 in resources.
Mm-hmm.
So, and if you have properties, of course, like if you have a homestead or even additional property, say you have a homestead and then you have a little land somewhere else, that's a resource. If you have life insurance or burial insurance and you have money that you can draw off of that, that's a resource. They're going to count that as a resource. If you have a car that's paid for and it's worth $3,000, $4,000, $10,000, that's a resource. They're going to add all of that to that, and that could put you over the resource amount. Mm-hmm. When you apply for Medicaid, they have a program called the Medicaid Estate Recovery Program, which is known as MERP. If you do qualify, the MERP, once you pass away, they can come back and file a claim on your estate to recoup back the monies that they paid out while you were on the program. The way to avoid them from doing that is that you can get a TOD, TODD. That's a transfer on death deed. You get that, you write it up, who you want to receive that property, and then you have to go file it at the county clerk's office where the property is located. It was around $50 when I did it for my mom. And then once she passes away, it transfers to me. If Medicaid come back and file a claim on the estate, it's protected through the TOD. Mm. But you can apply for Medicaid, but like I say, you have to be income and resource eligible. You can also, they have long-term insurance policies. If you're young, and I keep saying I'm going to do it, I haven't done it yet, but I'm going to look into it, and you can get those policies to cover some of the costs if you have to go into a facility and don't qualify for Medicaid.
And most of those long-term care insurance policies have to be in place before you turn 70, I believe.
Yes, yes.
Yeah. And you would definitely want to talk to a local broker and really do some education. Another person who you could connect with to kind of help with that long-term planning would be a senior financial advisor. And we have some resources that we can connect you to. A lot of elder care lawyers are certified senior financial advisors or estate planners. And so they're a good resource. And we have a number of those folks in our resource bank. So if you need that kind of help, or you want to have that professional look or professional chat, contact us at Age and we can get you connected as well.
And we also have a resource too through Texas Legal Service Center. It's a service available to people that's 65 and up and 65 and under with a disability. It's a free service to you guys. They do the TOD, they do the affidavit of heirship, they help with wills. Another thing is this one. They also will do, some people can qualify or put money into a trust to qualify for Medicaid. It's called a qualified interest trust, a QIT. Texas Legal Service Center also helps with that.
Yeah.
Another thing that our agency do is we also have a resource and information center. We have care coordination that helps with home modifications, well, grab bars, ramps, and things of that nature. We also assist with paying bills if you're in Travis County through Austin Utilities. We help with rent if we have the funding. We also do medication screenings. We have the ombudsman. So if you have somebody that's in a facility, assisted living, or a nursing home, you can reach out to them and they will go investigate if you feel like someone is being abused or neglected. So we are a wealth of information and resources ourselves too. So feel free to reach out. We have I think the number for that is 512-916-6062. That's our information and referral line. We help with transportation. We have a program that also helps with Alzheimer's and dementia through Baylor Scott and White. And so both of these programs, both of us, and they get us mixed up with age. One lady called
all
me
the
said,
time.
I'm trying to return a wheelchair I got from you. And I was like, we don't have wheelchairs. And then somebody was like, heard me. I was like, hold please. And I wouldn't ask. They was like, no, she's looking for age. So I had to give her the number to you guys. So
can you repeat that number again? The 512,
512-916-6062. So between the two of the agencies, we ought to be able to help get you some type of resource.
Yeah. Back to the questions. Jamie said, I live near Austin. Would you consider USAA to be local for the Medigap coverage?
So with Medigap, as long as you go with an insurance broker, I can, as a benefits counselor, I cannot sell you Medigap. It's a conflict of interest. Even if I had a license, I would have had to turn it over before becoming a BC. But with the Medigap, because it's all over, right? That's another thing. If you travel or you live in Florida 6 months, or you go live with your kids in New York or Baltimore 6 months, then you come back to Texas for 6 months, the Medigap is good to have because the Advantage plan is not going to cover. It will cover an emergency, but it will not cover you living there. So if you're visiting and you fall or have a heart attack, the Advantage plan will cover that emergency. But if you're living there, they're not going to cover that. But if you're on the Medigap, then it covers you live in Florida 6 months and Texas 6 months. So the thing with Medigap, it's nationwide, so to say. So when you get an insurance agent, I still recommend you locally get one, because USA is probably just something that they sell. It's probably just like Blue Cross Blue Shield, Humana, all of that. USA is part of that premium insurance plan. So I don't see it being an issue. The one thing about the supplemental plans, they cover A, B, and they gonna cover your excess, doctor's appointments, your hospitalization, physical therapy. If you go into rehab, where the Advantage plan after the 20th day, they may charge $170 a day. Well, the Medigap is going to cover that. So it doesn't matter if it's local or not. I just recommend you talk to locals because they know this area. They know your area.
Okay.
Especially with the Advantage plan. Now, Medigap, the coverage is going to cover. It's just going to eat that 20%. But you're not locked into a network with the Medigap.
Okay, super. Nancy said, when you mentioned the postal worker, was that coverage through the National Association of Letter Carriers? This
She
will
didn't
be a
tell.
huge
She didn't tell.
deal.
She didn't tell me. I don't know. She just said her they wasn't paying for her retirement insurance anymore. She didn't tell me what it was.
Nancy said, this will be a huge deal for my mom who's in her 80s. She took their Advantage plan this year, but is planning to switch back to the National Association of Letter Carriers health plan during open enrollment. Eek!
Well, if they not doing it, she won't be able to switch back.
Okay.
I'm not sure who. She just said she was a postal worker and they are no longer covering her insurance.
Okay. Selena said that there are only 3 benefit counselors or coordinators in Austin. Is that true?
That's true.
Wow. So is there a long wait to get in to talk to you?
Nope. You need to call and make an appointment at the number that I dropped. We are out because open enrollment is coming up. We had like 23 outreaches last month. We have like 20 this month. So do not try to pop in and surprise us. You're going to get surprised because we may not be in there. So please reach out and call us at that number. And what it is, each day each day, one of us have an on call where we answer live calls.
Okay.
If we don't answer the calls, we have 48 hours to return the phone call. So if you call and you get me or the other 2, you can set up that appointment time with whoever you talk to.
Okay, perfect. Selena also said that she tried being removed off the phone list and it didn't work until she completed the no robocalls. And that comment that I made about saying, please take me off your list, you would have to say that to every single different company that called you. But yes, putting your name on the registry, the no robocalls or do not call registry, will get it more widespread, taking it off.
Right. Can you drop that information in the chat so people will know how to do that?
Yes, I can in just a second. Medicaid, the comment too, Selena made about Medicaid. Medicaid is for those folks who are very income restricted, very poor. That is when that Medicaid cuts in, is part of it.
Very low. So the thing is too, like if I will say if you think you qualify Medicaid wise, income wise, be careful how you do your resources. Like go ahead and get properties out of your name. They go back 5 years. I always tell people have 2 accounts and don't let the 2 accounts meet. Be very careful with how you do your income and your monies and your resources when it comes to Medicaid.
Okay. Is the Todd different from the Ladybird deed? We've had a couple questions.
It is. So Ladybird deed came out first, right? And then the Todd came out. Both of them are beneficial and will protect the properties. The Todd trumps a will. I don't know if the Ladybird does it too, but if you have a will in place and then you have a Todd in place, the Todd will trump whatever you have in the will. So both of them were designed to protect property. So if you have a Ladybird, you can keep that. You don't have to do a Todd. You can keep the Ladybird.
Interesting. Okay. Let's see. Cigna Insurance. This payment is separate from Medicare and is called Part B insurance. That was a comment or a question?
The anonymous lady need to call me because I need more information.
Yeah, this was it.
Because if it's Part B, if she has a supplement, then she needs that. If it's something that she got specifically for optical, then she may not need that. I'm not sure where she's going with it because either it's an Advantage plan, a supplement, or something she purchased separate for optical, then she may not need that. But I'm not sure what it is, and I'm not understanding. So she may need to call me so I can get further information.
Okay, I wanted to also let folks know that you can call me, and my number is 512-600-9275 for resources. People were asking about, resources for transportation and stuff like that. I think you mentioned that, and so
Transportation is a big thing, but yes.
it's a huge thing. We were talking about making Medicare and coverage better. We need to also make transportation coverage better.
Yes, transportation and long-term care is a definite, they need to look at that.
Okay. Louise says, hello, please be aware I'm a local Medicare broker in Austin. My mission is to educate Medicare eligible people. I'm contracted with most of the large insurance companies and help the consumers select the plan for them. And so he wrote, I am vetted by Yvette's agency and made a presentation with Yvette last year, Luis Vallejo.
Oh, hey, Luis.
And he's going to be at the Walmart location, and he dropped his information, or he's going to be there with the annual enrollment at Palmer and I-35 Monday, Wednesday, Friday from 9 to 2. So
he is on our list. He is.
He is there. Perfect.
Yes.
So I am going to leave that comment live in the chat.
And that's another thing too. When you talk to brokers, you don't want to talk to a broker that's going to be locked into one thing. Like they're going to make you buy Blue Cross Blue Shield. They're going to make you do Humana. You want to get with somebody that has a range of premium options. Yes. So yes, Louis is one of our he is one of our independent contractors that's on our list. He is.
Molly was asking about the 5-year look back with a Todd. What about the 5-year look back with a Todd?
It doesn't have a look back. The 5-year look back is Medicare. Once you have the Todd in place, it protects that property. Because so if you transfer a property, that's a 5-year look back, right? If my mom transferred her property to me, now Medicaid would look back 5 years. With the Todd, you don't transfer. It doesn't transfer until that person dies. That's why it's called a transfer on death deed. So if you have a property in Austin, you get the Todd, you put that property on there, and you file it at the county clerk's office. When that person dies, it transfers to the person on that paper. Okay. If that person said, oh, I'm going to give you this because I want you to have it, and then file for Medicaid, Medicaid is going to look back 5 years on that property. Okay. So it's two different things.
Yeah. So if I wanted to apply for coverage and I owned my home and I said,
before you apply for Medicaid, get the Todd.
Yeah.
Go file it at the county clerk's office and then apply for Medicaid.
Perfect. Thank you. Thank you. Chandra said, not a question, but a huge kudos for this presentation. Thank you for the information shared. You're welcome. So much.
You're welcome.
That's awesome. One other, Selena said, my mother's attorney wrote a Todd, and when she died, her home transferred to her beneficiary without going through probate. So that's a huge advantage of that Todd.
You don't have to go through any, it covers it. It alleviates all the mess.
Wow.
Yeah.
I'm gonna make a note for myself just to have some more resources about the Todd too for everybody. So another comment, we're down to comments, I think. Advantage plans also make their money by denying treatments.
They do. Yeah, like a lot of complaints have been when they do physical therapy and occupational therapy. Sometimes they will deny those treatments, or sometimes they will not. Like if they do allow you to go in for 20 or 30 days, they may not extend it. So that's why some people stay on traditional Medicare or they pick up a supplement. So that is something you have to look into. Like I say, it's either full coverage or liability.
Wow. Okay. You know what? The only 2 question and answers or comments in our Q&A left are those anonymous attendee questions. And so anonymous attendee, I do encourage you, Yvette definitely wants you to give her a call at 512, let me see if I can go back up to the 916
916
6178.
Yes, give me a call. Just say I was at because that's just a general. If I'm not on call that day, I won't get the call. But if you ask for me, they'll transfer it to me.
Okay, perfect. Well, that's great. Yvette, is there any one thing that you're thinking, I want everybody to hear this and know it deep down in their hearts for when they're applying? This is the one thing I wish everybody would not forget.
To apply on time.
Apply on time.
Please, if you have any questions, like should I apply? Should I keep if I'm working? And if you don't remember anything, reach out to Miss Bunny or myself and we can walk you through it, because we don't want you not applying and receiving penalties for things that you just thought you had time to do. No question is a dumb question. I don't care. Reach out. So knowledge is power. So you will not pay at the end in the end for something we could have avoided in the beginning.
Okay.
Another thing is, please, please, please don't fall prey to Mr. Joe Namath. Don't fall prey to these people that's trying to get you to switch over that has no connection to you. Please use local people. Please,
Okay.
please, please. Because these people that's calling you on the phone could be in California, Utah, or wherever. They have no idea about Texas. I do have, like Mr. Lewis said, we partner with independent brokers. I have a list. I can send you a mail out to you, and you can choose from that list of people that's locally in this area. So you don't have to be out in the wilderness talking to somebody in California. Okay.
You know,
Just
Luis also, he just put in the comments, first of all, hi Yvette, I'm driving, but enjoy your presentation. But he also said Medicare Advantage companies sign a contract with Medicare and receive a monthly stipend to provide care to consumers, which I think is a really important point. And thank you, Luis.
They are independent. Yeah, they're independent contractors. That's why I said they're contracted through Medicare to cover your coverage. But in the process, a lot of things too that's going on that we're getting a lot of calls about too is a lot of doctors are not taking the Advantage plan. I've had several calls stating, oh, my doctor's no longer taking Advantage plans. He's saying I need to go to Medicare. And some people can't afford to pay that 20% out of pocket. And then they've been on Medicare too long to qualify for the supplement, because of course now they have to do the medical underwriting. So that's a lot of things that's coming about. The doctors are not wanting to fool with the Advantage plans because of that, like denying the services or not renewing physical therapy or things that the people need. They're not doing that or providing those services. So it's frustrating for the PCPs or the specialists. We're not dealing with it. So that's another thing that's coming up. But like I said, everybody can't afford, a supplement, or everybody can't afford to pay that out of pocket 20%. So you do have that option. And I'm just here. I can't sway one way or the other. I'm just here to give you the information.
Is there a 5-year look back with the Ladybird deed?
No. So when you say look back, you have to transfer the property. When you get a Todd or a Ladybird, nothing is being transferred. It's being protected.
Okay.
So if something does happen, once that person passes away, then the property is transferred.
Okay.
No look back is considered until you actually transfer one property to the next.
Got it. Thank you. So Nancy said, thanks. I have a lot of work to do before turning 65 in March. And I had written a question. My question about, like, in regards to that was, would you recommend that folks connect to a benefits counselor? Just even, they can sign up for 3 months before their 65th birthday. So would you recommend that they meet with you like 4 months before, or just at that 3 months?
I say people do that, and I have people that come to me early, and then when it's time to sign up, they call me again. So I say set a healthy boundary, maybe a month before, 6 weeks before, so you can remember what we talked about. And even though they'll come in and write some detailed notes, and then they say, I wrote this, but I don't remember what we talked about. So you want to be proactive, but not enough to where you don't remember what's going on. Because it don't make sense to come out 3 months to talk to me, and then the month of you call me back, and then we gotta go back through it again. So I say 6 weeks.
Okay.
Unless you research it, because some people research and then they'll come to me or call us and then they say, okay, I researched this. Explain to me what this is, and we can process it like that. But 9 times out of 10, once they come early, they call right back, and I have to walk them through, signing up or what have you, because they forgot something. I mean, it's up to you. I'm here. Our services are available. We don't mind doing so. That's what we get paid to do. Now, we do get paid to do that, but I don't receive any kickbacks or anything from no insurance agent or broker. Like I said, I'm just here to educate and inform. So however you want to do it, if you want to call me 3 months or make an appointment, we can do it. And if you want to follow back up, I'm here. There's 3 of us available. And I know we serve 10 counties, but we managed to do it. I've been doing it for 4 years, and it just works. So
it's busy. One other question that I had is, if a person retired from, say, for example, South Carolina, okay, they turned 65 in South Carolina, and now they're 72 and they live here in Texas, do they need to do anything different with their Medicare?
So if they just on Medicare, no. But if they have an Advantage plan, of course, they would need to get an Advantage plan for this area. So if you retire, you move here from another state or another city even, you have 60 days, 62 days. They give you 2 months. So 2 months to update your Medicare. You notify Social Security that you moved. If you have an Advantage plan, you will have to get an Advantage plan for that covered area. If you have a supplement, you let the supplement know I am now in Texas. That way they can make sure they make that transition and make that connection to you have moved.
Because if they don't, it could be that they're not going to get connected to the appropriate physicians who take their
so if they have an Advantage plan and they move to Texas from wherever, then they're out of network.
Mm-hmm.
So they're going to be paying out of pocket costs because it's not going to be covered.
All right, thank you.
So you need to make sure
get that switch.
Everything follows you. Yes.
Okay. The other question kind of in that is, when they make an appointment with you because they need to find out information about this, is it an in-person appointment? Is it a phone appointment? Is it a video?
So we can do in person, we can do phone, and we can do Zoom or Teams. We're flexible, but you still need to call and kind of make the appointment so we know how to adjust our schedules.
Absolutely. That's such great information. Thank you so much.
No problem. All
that's left, friends, in the Q&A is kudos to Yvette. So thank you, thank you, thank you.
Thank you.
I'm seeing one last question. Had to join late. Will this be available for us to rewatch? Absolutely. This has been recorded, so it will be available on our YouTube channel at Age of Central Texas. So you can always go back and watch it there. And Deanna just asked, if you could just quickly highlight again, what exactly is the difference between Medigap, Advantage, and supplement plans?
So Medigap and supplement are the same thing, first of all, and Advantage plans. So Advantage plans, you have co-pays, deductibles, and co-insurances. You are locked into a network, and you have to either go see your PCP for a referral or not go see your PCP for a referral, depending on if you have an HMO plan or a PPO plan. The supplement, aka Medigap, supplement and Medigap are the same things. It just covers the out-of-pocket costs. Medicare covers 80%. You will be responsible for 20%. The supplement, or aka Medigap, covers that 20%. Now, the drug plan is not included with the Medigap or supplement plan, but it is included in the Advantage plan. Like I said, that's the difference.
Okay, super. Advantage plans, are they Medicare replacement plans? Is that
yes, it's contracted. That's what they are contracted through Medicare to cover A, B, and D.
Perfect. Thank you so much for this Yvette, this has been so
Oh,
great.
and you cannot have, let me say this, you
Yeah.
cannot have the Advantage plan and Medigap. You either have an Advantage plan or you have Medigap. You
Okay.
can't have both.
Can't have both. We all want to have extra coverage, but
Right.
costs. All right. So I am so glad that we were able to do this for you all. We're coming up to our time. We have about 5 minutes left, but I'm so grateful too that we both overcame some technological challenges this morning and were able to provide this service. This has been fantastic, a lot of fantastic information. But everyone, I appreciate you being on this call. We've had a good attendance today, so that's great. I will let you know while we're on this call that we at AGE will be hosting another webinar like this in November about preventing Medicare, Medicaid fraud. So fraud prevention. So if you are interested in that, you can find that on our website at www.ageofcentraltx.org. I'll put that in there. ageofcentraltx.org. And we also have a couple of free conferences happening actually this coming week on Thursday and on Saturday, both. And you can find information about that. One is in Sun City in Texas. The other is in Pflugerville. That conference in Pflugerville is the African American Caregiver Conference. So we're glad to be offering that in Pflugerville, and then one in Sun City. And I see in the last few minutes, we had a couple more comments or questions. I've heard of other plans like F or G or whatever. Can you speak to that? Are there other plans?
So that's the Medigap. That's the supplemental plans. Their plans are F, G, N, A, B. Their letters also. It's just a supplemental plan.
Okay.
And like I said, it just covers the 20% that Medicare does not pay. Medicare, if you pick up a supplement or the Medigap, right now, F, unless you were grandfathered in, is not available. You had to be grandfathered in before, I think, 2021. So Plan G is the next plan up under F, and then it's N. But they all, like I say, they cover the 20% of the cost that Medicare does not cover.
Hilda asked, if I have an Advantage plan, but I'm not happy with it, can I change to Medicare A and B plus Medigap?
Depending on your previous medical conditions. How old are you?
That would be, she doesn't say. So Hilda, if you're still on, how old are you? That's what you were speaking about earlier, Yvette, right? About if you enroll right at 65, but then a few years down, you want to add this or that, then they're going to start looking at your medical history.
Correct.
Okay.
So if she's like
She's
67.
She's 67.
And so the thing is, it just depends on your medical history. If you are fairly healthy, then I would say go for it. But if you have some underlying conditions, heart problems, a stroke,
it's going to be problematic, maybe.
It's gonna be, yes. But it's like, if you
make your premiums, she's healthy. She's healthy.
Okay.
So you're saying go for it.
Yeah, go. If you're healthy and you don't take any prescriptions, maybe you take vitamins, or if you diabetic or high blood pressure and it's controlled with medication, I would say go for it. It may be a little bit more expensive, but I would go for that. Now, if it was something major, I would say they're probably not going to do it because you're going to be a liability.
Okay, super. Well, friends, that's the end of our time together today. Thank you so very much, Yvette. Thank you, thank you, thank you.
Thank you for having me.
Fantastic.
It's been a pleasure.
I hope you all have a wonderful, wonderful weekend, and this will be up on the YouTube channel probably by midweek. So I'm going to sign off for everyone. Thank you, everybody. Have a great day.
Thank you. Have a great day.
Bye.
Bye-bye.